Thank you, Joanne. Karen, can I ask you to manage the slide deck here, please? As we're waiting for the slide deck, what I'm going to emphasize is that what I'm going to be speaking to in the next few minutes here is not only the type of research which is being pursued within Queen's University Belfast, but also the context of practice that we work in. Could I have the next slide, please? This here, a report that was generated called Characteristics of High Performing Research Units, was published by King's College London and also the RAND Europe in 2015. Well, what it does is it identifies the essential ingredients for a high performing research group. And as you can see from this slide, at its heart is its people, individuals, investing in persons. And the glue that creates or supports that group speaks to research culture, underlying values, and leadership. And using this slide, I'd like to sort of superimpose it on the QUB research enterprise. Could I have the next slide, please? So looking at Queen's in particular, what I'm going to speak to is that it's the people. It's all about the people. Here in Queen's, the palliative care research agenda is actually spread across the campus, and you'll find a number of individuals who are practicing in the Department of Psychology, the Center for Public Health, School of Nursing and Midwifery, and School of Social Sciences, Education, and Social Work. Having said that, the critical mass of individuals within Queen's who represent this interest reside in the School of Nursing and Midwifery, where there's up to 35 members of staff and PhD students who identify with the palliative care research agenda. On your right, I've highlighted two enabling factors, which I think represents the glue in terms of moving this agenda forward. However, having said that, it's also important to recognize other aspects of the infrastructure, including research and governance or ethics and governance, et cetera. Next slide, please. With respect to the chronic illness and palliative care research group that's situated in the School of Nursing and Midwifery, the leadership is presently led by Linda Santin, and Joanne, who's with us today, is the Director of Research in the School of Nursing and Midwifery. This combined leadership facilitates development within this research group. Next slide, please. Approximately 2 years ago, this group engaged in an exercise of aspiration and generated the following objectives, which speak to promoting interaction and a collegial atmosphere within colleagues, promoting and developing a stable research program, cultivating strategic relationships, conducting and supporting linkage and exchange, and also developing effective patient and public engagement initiatives. And these objectives are really sort of the underpinnings or drivers within this research group. Next slide, please. One of the key pieces is this interface in the title, and it's the palliative care chronic conditions are important. There's two factors for the school. It binds the interests of a diverse group of individuals together, and second, it reflects a broader level of thinking in the practice policy community. Next slide, please. This here is a visual representation of the interface between palliative care and chronic disease care. Next slide, please. What we're seeing here is that this interface of integrating palliative care with chronic illness does have implications influencing both policy practice, but also shaping the research agenda, which is represented in our research group in terms of promoting an upstream orientation to care, adaptation of palliative care knowledge and expertise. And next slide, please. Operationalization of a palliative care approach to integration and contextualization within healthcare systems. The next slide as well, please. Drilling into sort of what we're actually doing within the chronic illness palliative care group, our membership are actually practicing research across a variety of settings, as you can see here, including acute care, home care, and residential care, and are engaged in a number of health conditions as well, including cancer care, dementia care, COPD, and the list goes on. Next slide, please. Within those areas, the directions of research that the membership engages in is symptom-based management, health services research, caregiver experience, etc. Some of the projects that the membership is currently involved in is the developing online resources to support families affected by cancer, developing online resources for care homes experiencing COVID-19 outbreak, delivering and evaluating a psychoeducational intervention for people with advanced cancer and their family cares, otherwise known as the dyadic intervention. The cancer prevention, survivorship, and end-of-life care in lower middle-income countries, which is Alinda is very active in. Support for people after cancer surgery for breast cancer. The list goes on. It includes cardiac rehab, addressing caregiver cardiac psychoeducational needs. So the interest expressed within this group is as diverse as the membership that's involved in it. And some of the challenges is sort of binding this group together. And that's where the importance of this chronic illness palliative care piece is an essential ingredient for the group. Next slide, please. So up to now, I've been speaking at a high level with respect to activities within sort of the school's palliative care research agenda. But to drill down, I would advise you that if you turn to our website and look at the chronic illness and palliative care, you'll discover the membership and the projects that they're actively leading. Can I have the next slide, please? Having just given you an overview in terms of what's happening in School of Nursing Midwifery, it's also important to sort of emphasize the interdisciplinary perspective and bringing together social sciences, humanities, management sciences, etc. Next slide, please. And this speaks to the role for the Center of Evidence and Social Innovation. This group has approximately 130 members and has a dedicated physical plant, which you can see the door just over there on the slide. And you can also see what its key strategic plan is in terms of capacity building, mentoring, etc. Next slide, please. This slide here speaks to leadership within the center, but also I'd like to highlight the themes that are being pursued here. Health and well-being, education, and what's called sustainable cities and communities. And as you can see under health and well-being, I have the lead in that group. And that is where the chronic illness palliative care interests are represented. That theme group actually has a life course perspective. So researchers it binds together researchers from the newborn and maternal health right to the end of life care. And this group has had a number of initiatives bringing people from across the campus together as well. Next slide, please. So to conclude, I think I've just given you an overview, a high-level overview in terms of what the research agenda is like, highlighting the School of Nursing Midwifery, and also speaking to CESI as an enabling feature to bind the community together across QUB. Thank you.